We're going to tell you a little bit about your pelvic floor and how to do correct exercises to help strengthen it during pregnancy. This will help the muscle be quite toned, and that can help you during birth, and of course it can help you postnatally, so that when you laugh, cough and sneeze, your pelvic floor will relax and hopefully you won't have a little wee. Important stuff. So a really great position to do this on is actually almost in all fours. So we'll start in all fours, and then we'll open the knees just a little bit wider so you have a firmer base. Your toes can kind of come a little bit towards each other. And then come down onto your forearms. That's it, and just bring your chin in a few degrees. Lovely. So we're going to focus on different parts of the pelvic floor. We're starting at the front. So Bethany, breathe in nice and slowly. And exhale. And just make sure you keep breathing really slowly as you do this. That's it. And then start to flutter the muscles at the front of your pelvic floor, the muscles all around the urethra. So we're fluttering them, we're turning them on and off, squeeze, release, as quickly as you can, whilst breathing slowly. So we're just finding the muscles at the front, we're giving them a chance to strengthen. We're going to work that for one more breath. And exhale, let it all relax. So now draw your attention to the back of the pelvic floor. We're going to focus on the muscles around the anus. So this time working with the breath, inhale, squeeze, and then exhale, release. Good. Inhale, squeeze, and exhale. So when you work your pelvic floor muscles, even though we're trying to isolate the front and then the back, you might feel it all start to engage. That's okay, just keep trying to isolate as best as you can. So keep going with this one. And what's interesting about this one is that as we inhale, we can really feel the strength of our pelvic floor. And what happens when we're frightened is everything gets tense. So the strength of the pelvic floor on the inhale, when it's tense, is what would happen if you were frightened during birth. When it's tense, it feels really closed and there's no space for babies to come out. So it's really showing us the importance of the exhale and relaxing and making space. So taking that concept one step further, we're going to relax that part of the body and now draw your attention into the middle of those 2 points. So we're focusing around the vagina. Inhale and just gently squeeze the vagina walls together. You might feel a really subtle lift into the body, and then exhale, just release and relax and soften and make as much space as you can. So this time the focus is much more on the exhale and that sense of making space and opening, so we have enough space for the babies to be born. Good, a couple more here. Light squeeze, exhale, big release. Lots of space. And then your last one. Good. So we're going to move into cafetiere breath now, which is a breathing technique you can do that's going to help push your babies down when they're actually being born. So we're going to inhale and just feel that light squeeze. Exhale, release, find lots of space. And then hold the muscles there on the exhale with a little bit of effort. Inhale somewhere else, breathe into the chest, and then exhale, bear down again into your pelvic floor and you found a bit more space. Inhale again, exhale, bear down once more. So we're turning the pelvic floor almost into a coffee cafetiere, and with every exhale we're kind of plunging that coffee cafetiere further and further down. Keep going with this one a little bit more, Bethany, and then when you're ready, relax. And then when you want to, you can just come back up and have a little break. Well done. So the cafetiere breath is really helpful if your baby got a little bit stuck in the birth canal. So what would normally happen is we'd inhale, maybe during our contraction, and the babies kind of ping up a little bit. And then as we exhale, we bear down and we push down and they come down. And this could carry on for quite a while and make us a little bit tired. And maybe if the baby's not coming out, then we need to do cafetiere breath to hold the babies in place So they don't ping up on the inhale, they just stay where they are. And then every exhale, it's a step in the right direction, just sending them down and out. Using that breath with contractions, with your midwives to help you, should hopefully really help get your babies out. The cavity air breath is really useful if a woman's giving birth and perhaps it's been suggested that she might need help with getting the baby out with some sort of intervention like forceps or von tubes. Both of those instruments actually don't just pull the babies out, they don't do that at all. They hold the babies in place. The von tubes is like a little suction cap that goes on the baby's head when they're quite near the entrance to the vagina. The forceps are more like salad spoons that go up inside of the baby's further up the birth canal. And what both of them do is, as the mother's pushing, they would assist in drawing the baby down, and then on the inhale, as we were saying, to stop the baby pinging back up, they would just hold the baby in place without any pulling. So they really work with the maternal effort. And then on the next exhale, mother pushes, and then they draw the baby down again, and on the inhale, they just hold the baby in place. So if we can use cavity air breath, it's a really similar way of our cells, our muscles doing that. And it might help us avoid some instrumental delivery. It might not work for all women, but it might help some, so it's a good one for you to know.